Hello and welcome to this very special conversation. My name is Biloni Bhatt. Collaboration is the key to getting anything done, right? I mean, it seems sensible. But very often, the response to a catastrophe or a calamity is confused and it is in silos. What it really does is that it impacts aid and help to people who need it the most. And today I have with me someone who's actually used the power and harnessed the power of collaborations, alliances, and partnerships to swiftly deliver impact at scale. I'm talking to Shiv Kumar. He is the co-founder of the Catalyst Group. Shiv, thank you so very much for joining us on this very special conversation.
Thank you, Meloni. Happy to be here.
So, Shiv, the Catalyst Group set up the COVID Action Collab, and the idea really behind it was to deliver help and aid, relief and recovery, provide that to the people who were worst hit by COVID-19. So, can you tell us how did that come about, and what is the sort of impact that it has generated?
Sure, happy to. As you know, government did what it could, and the problem was massive, right? And our journey of working on emergencies began during tsunami, and we saw that was also a big jolt for the country out of the blue, and it was a scramble. We were getting blankets where we didn't need blankets. We needed boats for the fishermen. We were not getting that. So I think working very closely with the government and civil society and foundations, what we managed to do looked like scrambling all the time. So when other humanitarian emergencies like COVID came, we said, can we do this a little bit more systematically? But then COVID is a very different ballgame, as we all realized, right? The effect of it was wide, deep, and long-term, right? It was wide because 1/3 of India, was struggling with unable to meet ends. And it is also wide because it affected health, it affected livelihoods, and it was long-term because we still are facing the impacts of COVID. So therefore we said, unless we all come together, the government, media, private sector and civil society come together, this is not going to be an issue easily doable by anybody. As much as government should provide the leadership, it is important to rally. So that's where COVID Action Collab was born.
And what was the kind of impact that you saw generate?
Yeah, we were quite audacious in the way we looked at things, and we were also very focused. We focused on the most vulnerable population because people like you and me could always get testing done, could get a bed with difficulty. But it was the poorest, the most marginalized communities who were really struggling. And that's where we decided to focus on them. We're talking about street vendors, we're talking about beggars, we're talking about sex workers, transgender communities, with whom we focused. And what we're very happy about is 2.5 crore of such individuals we call them special individuals. We were able to deliver a number of services, food, medicines, healthcare, and a number of things, including vaccination. So that's been the broader impact. And we have done that largely because of the 360 partners who are part of the collaborative. This can't be done by us. In fact, we are only humble holders of the platform as the shining partners, small and big, in remote areas and in cities who really stepped up. And our job was only to support them.
So let's speak a little bit about that. So India, has many deep-rooted problems, right? So we have problems in healthcare. COVID exposed a lot of that. We have problems in ensuring universal education. We have problems when it comes to ensuring gender equality, social equity, and so many other problems. How do we use alliances and partnerships to tackle some of these issues?
Right. That's a very difficult and deep question because our responses for child marriage is how do we stop child marriage? Our response to health is how do we build more hospitals, right? I think we have specialized ourselves in responding in silos and doing it not at scale, right? Intention is not impact. So that's where, assembling partners of certain capabilities together and bringing them together in a focused way into a geography or a community is what eventually we see getting impact. And let me give you an example. When government was vaccinating and making vaccines freely available very early on, it wasn't reaching some of the most remotest areas. I traveled to Muzaffarpur almost a month ago 53% single vaccine, right? So there are areas where things were reaching and there are large communities who are getting left out.
Just 1 second, Shiv. You said Muzaffarpur is at 53% with just the
first vaccination.
dose of the vaccine.
Dose of vaccination. And I'm talking about not the Muzaffarpur district whole. There were blocks within that which were low. And working closely with the district authorities, what we were able to do is to mobilize the communities. Literally did door-to-door campaigns, helped answer people. Whoever have taken vaccine, a 70-year-old man did a beautiful video. He said, if I can take it, why can't you young people take it, right? I think that mobilization is what helped bring people to the camp, and the government was able to deliver that. So this we could do because we worked with the local media, we worked with the local NGOs, we worked with the local schools, which helped us tremendously, and together we could make it happen. So that's the power of collaborative, right? It's about bringing the right people at the right time and the right place and providing that gap, which is actually not making things happen. And I want to talk about Bangalore, where we are sitting right now. Chikbalapur, one of the districts nearby, one district had so many different problems. In some places, no diesel for the vehicle. Some places, there's nobody to give the vaccine itself. In other places, it was the entire village had migrated, right? What do you do? So every place, it was different and very dynamic.
You know, I want to speak about the India perspective. How do we go about building trust between the various stakeholders, you know, that deliver for communities, for welfare? So trust between those and to the communities whom they serve. So how do we build trust between all of these various partners?
I think if we talk about trust, I think the first thing we should talk about is why is there a lack of trust? When you do work in this area, very funnily, there should not be competition, but there is. Because the total amount of resources required and what we actually have is so vastly different. Even civil societies compete with each other. And therefore, trust cannot be built easily. And the second is what we call as the logos and egos challenge. When you want your logo and you want attributability to your work, that comes in the way. And a third big problem is the format. What's the format in which we collaborate? How do you and me together is not just 1 + 1, is actually 11. And therefore, even if you were to divide the thing half, it's 7.5, or sorry, my math is so bad, 5.5 at least, right, to each of the parties. I think that's where the big differential lies. So if you address these three things systematically and have a governance mechanism which does that, and you listen carefully, you know, to every point of view and incorporate, then you can make a change.
You said a couple of things, you know, which I want to pick up on a little bit later. But you mentioned something very interesting. You spoke about, you know, competition and then having a complementary approach. So from the social sector perspective, how do you ensure that alliances and partnerships are complementary rather than competitive, and so they're able to deliver to the greater good of the communities or the populations whom they serve?
There is no one formula, Miloni. I think we tried various things, and I must admit some things succeeded, some didn't. I think very important is not to romanticize partnership for the sake of partnership, right? It's always nice to say, let's do things together. But there are transaction costs. There is also the pain of collaboration. There are various work cultures which clash with each other. So what we found useful was two major things. One is we got the partners together and said, what can you give and what are your asks? And can we set it up almost like a marketplace where you build your own partnerships? I think that really worked. We had around 650 such partnerships which emerged out of the 350 partners. The second thing we did is what we call as, open arms and open mind approach, right? And there what we really meant is that talk to partners continuously, understand in each of the areas what is coming up, but then craft a program which can do two things. One, can go to scale and can get financed. For example, when we looked at vaccination, we developed the vaccine framework with our partners. How are we going to vaccinate some of the poorest people? Along with it, we came up with this method saying every vaccine will be for $1. Not the vaccine itself, which government is giving free. It will take $1 to generate demand. I think that kind of a formula-based approach also helped us to go to scale.
As you said, partnerships are deeply unequal, right? Some partners may have greater leverage, some partners may have greater social capital. So how do you then, make sure that these partnerships are, what is the sort of modality or the framework that you would suggest, the approach that could be followed for partnerships that can actually help the communities, rather than sort of fight within themselves?
Absolutely, you're right. I think partners come in various forms, sizes, interests, and partnerships are also similar, right? It works in various levels. I think what we have, I would say, managed to do, and we are still trying to improve, is to create the base frameworks in which everybody can participate, right? And that's extremely important. For example, the initiative that we did on surveillance. This was sewage surveillance, which was a well-known technique which is used in other countries, but we were not using it in India. So we brought it to Bangalore, and we said in all the 52 wards, we are going to be testing sewage water, so we can give government a 15-day advance notice of outbreaks, and it was extremely useful. Now, when we did that, we had to partner with a whole range of people within COVID Action Collab and outside COVID Action Collab. So what we did is we sat with them, and we have a methodology called the Impact Canvas, where we invite partners and say, we want to give 15-day notice to the government of an outbreak. What can we all do? So labs said, we will collect the samples and we will test them. And then we had financiers who said, we will fund this operation. Government said, okay, we will feed this into our dashboard, right? And then we had another part of government agencies which said, oh, we've been doing this earlier with other surveillance, we'll bring the data together, right? And then our role became clear. How do we orchestrate this so that we move everybody in that direction? So it didn't matter whether it's small or big, if everybody had a meaningful role and we all had a common impact, I think then it became easy. Now I'm putting this across very simplistically. It doesn't actually work like that. There are lots of fights, there are lots of arguments, there are lots of hugs. But at the end of the day, if we can keep reminding ourselves of the result, I think, and create the spaces and be respectful to each other, I think that's extremely important. The humility factor, along with value on the table for everybody, I think changes things, Melanie.
The rate at which things are changing in the world, the scale of the problems that we face, and our ability to deliver solutions at scale requires innovative thinking. And partnerships often bring about this sort of innovation. But what is the kind of framework that can be adopted, so that we can deliver social innovation to communities, to the people who are most vulnerable and who need it the most? What is the sort of framework you would advocate?
Right. Things we're working on, which I would seek to answer your question. Number one, we found that we need to focus. We need to focus on specific people and their problems. Like I mentioned, street vendors, community. They're struggling with climate change. They're struggling with everything moving online. How do you help this community? So you need to have very community-specific solutions, right? And building their resilience in terms of where they're headed. The second part about it is we need geographical focus. I think one of the things in COVID we did a lot of things everywhere, right? And we were like in Tripura, and the next day we were in Pondicherry, and the next day somewhere else. I think we learned that if you want some deeper impact, we will need to focus. And government has given a framework for that called the aspirational districts. Can we focus in those districts to make the change? That was the second big area. Third is we need innovative solutions, right? And a whole range of them have come about. And one of them is, when we had this massive plastic problem during COVID, remember all of us were covered in plastic for some time in various forms. What do you do with those plastics? And that's where our team dug in with experts and multidisciplinary teams and found actually you can convert the plastic into oil. Right? Plastic comes from oil, and you can convert it back using pyrolysis to oil, and that oil can be used in generators in the hospital. Now, these are the kinds of solutions which not only benefit people, but also the planet, which are very critical, right? So we are opening our doors and our minds to looking at innovative solutions, which will not only solve today's problem, but be ready. To me, Melanie, I think COVID was just a trailer, and we struggled with the trailer, right? I think when we are hit with the big climate change, impacts, I think we had better be prepared in a very big way.
Shiv, why don't you tell us about some of the things, you mentioned climate change and how we need to be sort of future ready for a lot of those catastrophes and calamities which might strike us and which might need a community response. Agencies working in silos just won't make the cut. Could you tell us a little bit about some of the programs or some of the initiatives that you're working on, that could help us be future ready?
Absolutely. Sewage surveillance. In fact, we started with COVID. Now we have added influenza, we have added monkeypox, and we believe typhoid and many other things can be added to it, right? So that's one kind of innovation. We started taking it to other cities. 5 other cities have now got funding and approach. This can be scaled across all of India, right? Which will give governments a very early warning of a variety of things, not just COVID. The second is, I mentioned to you about the district approach. And we found there's a great resonance among donors. Bill and Melinda Gates Foundation is talking about it, USAID, ADB, World Bank. So we used the platform of the Comprehensive Primary Healthcare Alliance, which is also a partner of CAC, and called on donors to say, can we come together and develop a playbook for integrated health response, and can we integrate disaster management within that? So that the district not only knows whether it's going to be flooded or it's going to be a heat issue or both, and how do we prepare ourselves. So we are in the process of now putting up playbooks, which will be something every district can use in preparing an integrated disaster management and health plan together. And these are the kinds of innovations which are making us ready, what I call as ready to spring into action, so that we are not scrambling into action next time.
And able to spring into action and not scramble. I mean, that COVID, obviously there were deep and big lessons for all of us. But, say something like that kind of struck us again. You think we'd be able to mount a cohesive response?
Because it's not easy anymore to say what is going to be the kind of things we're going to slam under. I was in Portugal recently and they told me about how Lisbon was hit with an earthquake, which followed by a fire and a tsunami, right? But it happened. And something similar happened in Japan because of the nuclear, this thing. Be prepared. And I think I have seen this happen in my life. If you go to Kendrapara region of Odisha, which used to be hit by cyclones almost every year and thousands of people dying. Today you go there and you see the disaster preparedness has saved lives, right? So I feel we have a responsibility to be prepared. And whether we will be able to respond as well every time, I think time will tell us. But I think important to be prepared, important to be mobilized and learning from our past, right? I mean, we learned from tsunami and did a slightly better job in COVID. I think we have to learn from COVID to do a much better job for the next emergency.
The word learn from COVID, because obviously COVID's not really over.
Right.
We're still seeing the lingering impact of it, and it's probably generational, because learning outcomes and so many things have been deeply impacted. Shiv, this is literally my last question to you. From your vantage, when you deal with all of these partnerships with agencies, would you be able to quantify that in terms of, say, government and then say in terms of private bodies? Where often do you find the choke? A lot of street wisdom would say, it's probably at the government level, but we'd like to hear, what are your thoughts on it?
I'm going to be contrarian on that. In fact, we work with 34 local governments, including state governments. Not one of them turned us away. Every one of them were not only supportive, but also provided us resources to make things happen wherever they can, right? And in some places we had to do that. So I don't think in today's world, if you were to frame what is the development impact you're wanting, there is a challenge towards it, right? I think the challenge is how, the challenge is resources. And we'll only finally, we have a population which is so large, it's actually human resources which is a big challenge. The right skilled people with the right attitude to do what we are doing. So to me, if you're looking at large scale impact, being prepared for emergencies, I think we need to address these 3 issues, right? It's the frameworks, the resources, and the people who will bring the leadership to the front and make it happen. I think building on the COVID Action Collaborative, our ambition is to plot out all the vulnerable districts and ensure that each of them have a plan for potential disasters, right? So as we were discussing, keeping them ready in case of climate change or other emergencies which come up. That's a large amount of work and a little bit of a boring work, but has to be done. But the exciting pieces which are happening is also how we are scaling up some of the things which worked during COVID, the sewage surveillance which we want to scale up, the pyrolysis-led approach to solving the plastic problem which we want to scale up. That's other exciting bit. And the third exciting bit is also, we're pushing ourselves to think along with our partners, can we set some audacious goals, right? For example, 60% of women are anemic in India. And that's only increased over a period of time. It was 50, now it's 60. Can we look at solving that problem in our lifetime, right? Can we make that zero? Can we make India anemia free, along working closely with the government? Similarly, we don't talk about digital divide. And the interesting thing, Maloney, is that new subscribers have stopped coming into telecom, right? And that happened last month, which means beyond this, poor people are not really subscribing to all the internet services you and me have. Can we look at removing the digital divide during our period? So these are some of the audacious goals that we're looking at. How are we going to do it? We don't know how, but we feel the power of our partners together that we can probably craft solutions and resource it and make it happen.
All right, Shiv, and we wish you all the very best as you go about, tackling all of these challenges and bringing in the power of collaborations, alliances, and partnerships to really foster this whole framework where everyone can work together and build on our social goals. Thank you so very much for your thoughts and for your time today.
Thank you, Miloni. And as much as we have done work in COVID and we were called the COVID Action Collaborative, Miloni, I'm very happy to share with you. We've decided to rebrand and reposition ourselves as the Community Action Collaborative because, as you said, COVID may be coming to an end, but I think the reason to work with communities is actually increased. So thank you and for your well wishes. And I do hope people who listen to this would reach out to us. It's communityactioncollab.org, which is our website. Do go there, and I would love to work with you, and I would love to work with media very closely. Thank you so much.
Thank you very much.